UHN, we work every day with one purpose in mind: transform the lives of our patients through excellence in care, discovery, and learning. Our vision is to impact patient care here and around the world. Our success comes from our people. We recruit the best, the brightest, and then champion their big ideas.
I'm Dr. Shafika Shafji.
I'm Dr. Heather Ross.
Dr. Jordan Feld.
Dr. Mohit Kapoor.
Dr. Valerie Wallace.
Dr. Cristina Nostro.
I'm Dr. Mike Tomiansky, and we're going to eliminate brain damage caused by stroke.
My dream is to make organs that will live forever.
My dream is to cure blindness.
To make a world free of hepatitis C.
Cure type 1 diabetes.
Cure arthritis.
I'm going to stop heart failure before it ever happens.
Every 10 minutes, somebody in Canada dies from a stroke or has a stroke.
The stakes are high. Thousands and thousands of people die every day of lung failure.
I work in the field of osteoarthritis. It is one of the most common forms of arthritis, which is affecting millions of people worldwide, which has absolutely no cure.
Type 1 diabetes is an autoimmune disease. Your own body is attacking the cells that produce insulin and destroys these cells. So the only solution is for people to inject themselves with insulin, either through a needle or a pump.
Currently, in Canada, there are 1.4 million people living with macular degeneration. And right now, there's absolutely no cure for that condition. So it's a big problem, and it's a problem of our aging population.
Hepatitis C tops the list of all infectious disease killers in the country.
Okay, so we're just going to do this quick scan of your liver. So I'm just going to get you to put your arm up over your head.
About 250 and maybe as high as 400,000 people have this infection around Canada. This infection causes more years of life lost than any infectious disease in Canada.
Heart failure is an epidemic in Canada. Once heart failure is established, it doesn't really get cured. The average life expectancy after the diagnosis is 2.1 years, with 50% mortality at 5 years.
We're currently in 2 final stage clinical trials, in which one of them, drug is being given to patients in ambulances. In another trial, it's being given to patients who undergo endovascular stroke therapy. This is a drug that's intended to stop the stroke from progressing the moment that the patient receives it. Because the sooner you give the drug, the more brain there will be to save.
What we're doing in my lab is putting in healthy cells into a retina and seeing if they take, and if they will restore light sensitivity and vision.
I'm working on creating the first blood test which could detect patients with what stage of osteoarthritis you have, or if you actually have osteoarthritis or not. Secondly, I'm working on 2 injectable therapies which would be injected into the knee joints to be able to stop osteoarthritis in its tracks.
Right now, we are able to generate cells that produce insulin in the lab. We have a specific cells that will turn green every time it produces insulin. And the next step will be generating a way to transplant them into the patients and protect them from being destroyed again by the body.
The benefit of developing the ex vivo technique where we could actually take the organ out of the body, keep it alive, and heal it, has allowed us to increase the number of donor lungs we can safely use. So in Toronto, we've increased the number of lung transplants by 50%.
In order to actually truly change the natural history of heart failure, our scope has to be on prevention. What we're trying to do is to get as much data as we can on every patient and every person. We then want to apply artificial intelligence or machine learning. Brains much bigger than ours have the capacity to look for patterns in this information to try to predict somebody's risk. Once we identify those risks, intervene sooner to try to actually prevent heart failure from happening.
We're trying to do something that even large pharma companies had not succeeded in doing for stroke.
We are trying to find something which nobody has actually found.
Science is the way to get where no one's ever gone before.
Sometimes you question if you're going in the right direction.
Challenges are to be expected.
In research, you get setbacks,
Failure is a big part of research.
but you have to be persistent.
You pick up and you find another way around the problem.
And really, every time we come up with a setback, we're thinking about ways to try another strategy.
You learn from your mistakes, like in everything in life, and then you use that to build and move forward. It's important, actually.
That's just the nature of trying to be innovative and disruptive.
If you can't deal with failure, you cannot be in medical research.
And that's a normal thing, and I think it just keeps you thinking and challenging yourself.
No obstacle should be too big if you believe in what you're doing.
I love what I do, and I see the bigger picture to be able to cure patients with osteoarthritis.
I'm passionate about my work. What we do in the lab can change lives. And I think this is extraordinary.
It's actually quite a privilege. I just couldn't imagine myself doing anything else.
If our research pans out, we will have touched the lives of millions of patients.
The bottom line is that I don't want to see patients suffer.
My name is Sherry Hughes.
My name is Craig Thorburn.
I just went for a normal physical that I do every year, and my family doctor saw that my liver enzymes in the blood work were slightly elevated.
The diagnosis I had was something called hypersensitivity pneumonitis, which is a big, long, complicated word for really nothing more than, inflammation in my lungs.
So he was a little concerned and asked for more blood work to be done.
I couldn't walk 50 or even 30 paces without being tremendously out of breath.
It was hepatitis C, and I was in complete shock.
I had a big problem and I might not survive it.
I see the suffering of my patients, and I can come to the lab and find a solution. Say, how can we solve this problem?
The best thing that ever happened to me was December 7, 2016, when I had 2 lungs from an anonymous donor kindly given to me.
I've dedicated our work and our team to saying, can we make lung transplantation safer? Can we make it available to more patients?
Well, when I woke up, it was amazing. From the moment I regained consciousness, I took a breath and I said, my gosh, this is different. I have a new life.
Can we actually make a lung that will get people back to living their life?
Life is amazing. On Saturday, I walked 18 kilometers, and on Sunday, I walked 14 kilometers. And I do it without any shortness of breath.
The things that we're doing now, I mean, when I started in this business, that was not even dreamable that we could do that.
Dr. Khoshavji is the head of the team, and they are amazing.
Every day I meet people who are alive because of the work that we do. And that's inspirational.
It's a miracle. It really was a miracle for me, and it still is.
It's been an exciting time in the past few years working in the hepatitis C field. Starting in 2011, 2012, we started using so-called direct-acting antiviral drugs.
Oh, I loved it. No injections, a pill, no side effects.
And to our astonishment, from very early on, we were able to achieve very high cure rates.
Heaven sent Harvani.
We've actually gone from discovering a virus to curing it in just 25 years.
It was a miracle, because in 4 weeks there was no sign of the virus. It was no longer there. I no longer had hepatitis C.
We are curing chronic hepatitis C so that people never have this infection again and go on and live healthy, productive lives.
I'm getting ready to go on a big hike in Patagonia, and I really had this goal that I was going to dance at my youngest granddaughter's wedding.
Sometimes people say to me, okay, well now Hep C is done, what are you going to do next? Hep C is not done. We still need to diagnose somewhere between 50 and 70% of the people living with hepatitis C in Canada, and we really need a vaccine.
We believe that we're about 3 years from finding out whether all this research that we've done for the last couple of decades will result in a treatment for stroke.
We are hoping to have the blood test ready in the next 3 to 5 years, and we are currently testing injectable therapies, which we are hoping by 7 years we would be able to deliver in patients with osteoarthritis. This would be the world's first blood test or therapies which could either detect or stop osteoarthritis.
I definitely can see the path to the dream. The stem cell therapy will be coming up in 5 to 10 years.
We have a very sizable amount of data, which is almost 40 separate databases, and we're starting the process of artificial intelligence on that information. And I think that it is through this that we hope over the coming 3 to 5 years to really get a much better handle on what people's risks are.
As we have shown the way with lung, others are doing the similar things with liver, with heart, with kidney. And I think it's totally going to transform how transplantation is performed around the world.
I wouldn't be here without philanthropy.
Almost 50% of my lab, my research program runs because of philanthropy.
It can't be done without you.
It's a critical part of UHN going forward.
Resources in the form of boots on the ground, people working at the bench, and the latest in technology.
And without their help, we couldn't be doing the work that we're doing today.
Initial discoveries which we've made in our lab would never see a light of day if philanthropy was not there.
And hit the home runs right out of the park.
And as we pick up speed, we're picking up partners.
I want to thank all of these philanthropists who have helped us. We do receive research grants. We get a certain element of support from our organization, but philanthropy in this day and age is huge and absolutely essential.